Welcome back to WBRZ News 2 at 4. Dr. Stevens is back today, and in light of Breast Cancer Awareness Month, we're talking more about breast reconstruction. So welcome back.
Well, thank you. Glad to be here again. And you know, last week we talked about breast reconstruction utilizing implants and tissue expanders, which is a great way to reconstruct a breast. Well, not all women, patients, are afforded that luxury. Some with mastectomies that are removing skin and breast tissue require using their own body tissue, as in tissue from the abdomen, which is called a tram flap, made popular back in the 60s. Now we're using some tissue from the buttocks. This is an example of the tram flap where we actually transplant tissue from the abdomen, tunneling it up through to the breast, and sometimes we can actually take it loose, as in this photograph, and then transplant it using microsurgical techniques back to the chest wall, forming a breast mound, and then forming the nipple bone reconstruction later.
Okay.
And it's a great way to do this if you don't have enough skin that we've taken with mastectomy. So techniques are different depending on what we're missing. And so we have to think about what the defect is, and then we use various body parts to reconstruct what we're missing.
Interesting. What's the most common area?
Well, the most common thing, if we're going to use free tissue, as we call it, is from the abdomen. Even to the point that we can do it as maybe a tummy tuck, if you will, removing the fat and skin only, and then transplanting it to the chest wall, forming a breast mound, which is a great way of doing it. We've even found ways of doing it now without taking the muscle and just taking the fat and skin and then transplanting to the chest, more like an abdominoplasty, if you will. And so it's a great technique to use if you're a candidate for it. And that's the point, that we need to talk to the plastic surgeons and make sure you're a candidate for this versus one of the other techniques. Another one, as we're showing now, is using the back, which is latissimus muscle, wrapping it around to the breast, and then, or where the breast would be, and then putting an implant underneath it most commonly. And this is a great way to reconstruct a breast using your own body tissue as well. And even the buttock, as we're showing a picture here, called a gluteal flap, using the fat and skin from the buttock and then transplanting that to the chest wall, making a breast mound. Some women they don't have enough abdominal tissue, and so we have to think of different areas where we can rob Peter to pay Paul.
Okay, well, thank you so much, Dr. Stevens. We appreciate it. You're watching WBRZ News 2 at 4. We'll be right back.
If you have met